Hey there everybody, Sage Apopum here, founder of the School of Evolutionary Herbalism. And in this week's episode, I wanted to share with you some of the overarching kind of categories of herbal actions and energetics and properties that are used to treat upper respiratory allergies as well as asthma. Especially upper respiratory allergies can sometimes be a little bit tricky to work with as an herbalist. And oftentimes it's because what we see is, in a lot of over-the-counter herbal products, kind of a very singular approach based on, studies that have shown this particular constituent helps with allergies. But as a holistic herbalist, we're looking at things on a much deeper level, right? We're looking at the underlying ecology of the tissues and what types of remedies and energetics and actions are going to help to balance the ecosystem of the tissues. So this discussion is really focusing on, giving some lists of some remedies to consider for treating upper respiratory tract allergies, but really on a deeper level, looking at kind of core actions and energetics and categories of remedies that you would consider, and also sharing what can be literally a life-saving, simple 2-herb formula for treating asthma attacks. So hopefully you enjoy this episode here on working with herbs for some very common upper respiratory tract complaints. Okay, Monica, and question number 5 here is asking, how do you suggest treating respiratory allergies or asthma? Had a couple patients treated with different mixes, including basically Kalawala and Petiveria alliaceae, but didn't work apparently. What would you suggest? Yeah, great question, Monica. Well, first off, unfortunately, I am not familiar with the plants that you're referring to there, Kalawala and Petiveria alliaceae. I don't know those. I've never heard of those remedies before, so I don't know what those plants are reputed to be doing, so it's hard to say. But I can answer the main question here on treating respiratory allergies and or asthma. So, again, kind of like what I was talking about here just in the last question with the skin conditions, is that oftentimes respiratory tract allergies can also be traced back to food allergies. The body has a certain degree of an allergic load that it can tolerate. And if a certain proportion of that allergic load is being taken up by a food that your body is intolerant to, when you get exposed to, maybe pet dander or certain pollens in the air and things like that, it's going to tip the scales, and then you'll start expressing symptoms of that allergy. Now, that being said, some people are just predisposed to being very allergic to, certain plants in the environment or certain pet danders. We could say it's a genetic thing that there's just not really any way around. But we can work with plants to help, mediate and moderate the symptoms. So, asthma can be in that category too. They say that people with asthmatic conditions, that can also be a food trigger based thing there. So now the herbs that I typically would consider using for asthma are quite different than the herbs that I generally would recommend using for allergies. So I'm gonna kind of talk about them separately here. So with allergies, respiratory allergies, oftentimes we're speaking of upper respiratory tract, right? Sinuses, throat area, kind of here up. This is oftentimes where we see most respiratory route allergies. So you get the sneeze and, very sinus congestion, or sometimes very, what do you call it? Just leaky mucosal membranes, right? A runny nose. Puffy, swollen eyes, redness in the eyes, sometimes a tickle or tingle in the back of the throat. and then sometimes a bit of a cough as well. So typically what we see with most allergies is a pattern of dampness alongside with heat, because a true allergy is an immune mediated response associated with histamine, which leads to inflammation, hence heat. But then there's a vital response that happens here where the body is producing an excess amount of mucus to try to clean the local area out of the irritant, right? So there is this intelligent response of the body trying to wash the area clean by producing all this mucus, but that typically leads to some discomfort, hence the swelling, the stuffiness. Histamine tends to dilate things, so the mucous membrane becomes relaxed, and then you see that thin, clear mucus running out of the nose or the postnasal drip. So oftentimes, the way we like to approach this is through decongestants, which are generally plants that help to drain fluids out of the upper respiratory system. Now, I find there's oftentimes two kind of general categories here. One is actually diuretic plants. That's kind of cool how a number of, actually, let's see, three of our main plants that oftentimes are used to treat allergies also have diuretic properties. So here we see nettle leaf is a big one, goldenrod is a big one, and eyebright is effective here. I'm not sure how diuretic eyebright is, but also elderflower. And elderflower is a little bit diuretic, but it's more diaphoretic. And this is actually, diaphoretic plants are really great because diaphoretics have an overall energy of moving up and out, right? And, this whole area is really hard to get stuff to because the bone structures in here are really complex. There's not a whole lot of, the capillary beds are really small. It's hard to get circulation up there. So diaphoretics, through opening up capillary beds and generally moving things up and out, are really beneficial for treating upper respiratory tract dynamics. Elderflower here being a big one, yarrow being a good one, as well as peppermint. That's kind of a classic diaphoretic formula used in traditional Western herbalism. Peppermint, yarrow, elderflower, but it also really works nicely to decongest the sinuses. Goldenrod, also very bitter here. So bitters oftentimes will work through the mucosal membranes and help to drain fluids out. And nettles being great here because it drains fluids, is diuretic, but it's also very inflammation modulating and helps with that histamine response. It's kind of a like treats like thing, right? You touch nettles and it initiates this histamine response when you get that sting from stinging nettle, but internally it helps mediate the histamine response, and hence its very popularized usage in the treatment of allergies. That being said, you got to use typically a lot of nettle leaf in order for it to be very effective at treating allergies, and I think getting it in you as quickly as possible is very important. The other side of decongestants is the very pungent plants, right? So we kind of have these bitter, fluid draining diuretics. Then we have these very pungent aromatic ones that are spicy, right? And bring blood flow up into that area. They're oftentimes plants that, you put them in your mouth and they're so spicy, they really just kind of open everything up, right? This is, really hot, spicy peppers or hot sauce or wasabi, right? And I think the main remedy here that I think is the best is horseradish. Very, very pungent, very good for dilating and opening up the sinuses, draining fluids, bringing blood flow. So that's a really great remedy to consider. Black pepper can be used here. Cayenne pepper can be used here. I think just the spicier, the better. Even ginger can be effective here as well. The other category of plants useful here is the astringents. So as I said, more often than not, when we're talking upper respiratory allergies, we're usually seeing a damp relaxation tissue state. Postnasal drip, runny nose, the eyes are watering, everything's just kind of secreting. You get all these fluids leaving and then everything gets swollen and you get kind of stuffy up here but drippy down here. This is where an astringent is really, really great to help tighten up those capillary beds, reduce the swelling, dry up fluid accumulation, and prevent that leakiness happening in the mucosa. Now again, as I mentioned before, this is a vital response. So, sometimes I'm a little hesitant to use astringents too much because perhaps it is being suppressive. But a key remedy here actually is golden seal. Is a very reliable mucous membrane tonic. It's very bitter, so it drains fluids, but it's also very astringent. This is also why eye bright is so effective at helping to alleviate, eye inflammations and upper sinus things, because it's also quite astringent and drying to the local area. So those are some of the remedies that come to mind off the top of my head. And then, in general, aromatic plants. So anything that's going to help just disperse stagnation and reduce inflammation. So a lot of the mints are really excellent here. Peppermint. Peppermint really is the main one that I use there, but even spearmint, the menthol containing mints, very great for dispersing, kind of opening up, right? Opening up and relieving that stuffiness that you get oftentimes. And then anything that's going to drop inflammation down. One thing I learned from Paul Bergner is chamomile yarrow tea. And you can put some peppermint in there to make it taste a little bit better. And then just sniffing the tea, like the steam and all the aromatic essential oils, can really help to reduce the inflammation that occurs with an allergic response. So those are just some remedies that I consider for an acute upper respiratory allergic type response. And usually, admittedly, these can sometimes be a little tricky. Sometimes certain herbs work very well for some people. Other times they don't work at all for some people. I know people that have worked with nettle leaf for years and swear by it. I've worked with other people that are like, yeah, it didn't do anything for me. So I think it just really depends on the person and finding which type of remedy will work best for you. And of course, formulas are also a really great option here. Now, as far as asthma, especially people with serious asthma, I think it's important for them to have their inhaler, right? We don't want anyone to die from an asthma attack. So just keep that in mind. But there is definitely a way that we can work with plants to prevent serious asthma attacks, especially if you catch it right at the acute onset. So this with asthma, what we're seeing is contraction of the smooth muscles around the bronchioles. So again, oftentimes in response to some sort of allergy or even stress, things like that. So, and restricting the airway, and thereby we have difficulty breathing. So the main category of remedies used here are our antispasmodics or relaxants, and those with a specific affinity for the lungs. To me, the number one remedy here is Lobelia inflata. I really like Lobelia. I think it's the most effective bronchodilator out there because it is just so profoundly effective at relaxing constriction and tension and spasm on the smooth muscle level. The other plants, any type of smooth muscle antispasmodic. So you could use cramp bark or Viburnum opulus. You could use one remedy that I like with a good affinity for the lungs is skunk cabbage, Symplocarpus fetidus. Not a super popular remedy, but it is a very effective respiratory antispasmodic and also helps to clear dampness from the lungs. And that's the other thing with asthma is, yes, we want to relax the constriction and spasm, but I also think paying close attention to what the underlying tissue state of the lungs are so that you can balance them. So if they're really dry, maybe giving some demulcents like licorice to moisten the mucous membrane. If they get really damp and phlegmatic, giving some pungent stimulant expectorants like elecampane or lamatium or horehound, things that'll clear the lungs of phlegm. And then, especially the moisture quality, I think, is very important for the lungs. Back to our antispasmodics, black cohosh or Simicifuga racemosa can be really great for relaxing bronchial spasm. And then I also really love wild lettuce here, or lactuca is really great as it's a nervine hypnotic. It's also a very beneficial antispasmodic and relaxant, but I find it has this very nice affinity for the pectoral region. Oftentimes when people take a really strong dose of wild lettuce, they really like they'll let this big sigh and you can just see the whole pectoral region kind of open up. I really use that plant a lot for people actually that have an acute cough or respiratory infection and it's preventing them from falling asleep at night. Wild lettuce is one of my go-to remedies. I've been using that plant a lot over the last few years, more often than not for pain management, but every now and then I get to use it in treatment of the respiratory tract and helping people to sleep from spasmodic coughs. The other type of remedy that can be used here is what we would refer to as plants that are adrenergic, meaning that they imitate the response of the adrenal glands. So the main remedy here is ma huang or ephedra, the Chinese ephedra that, I don't really know what the status of ephedra is these days. I know a while back, it was very difficult to obtain and I think was banned completely because people were using it kind of as this stimulant and were taking a lot of it, and I think it was giving people some problems. But so the thing about, and this is really how inhalers work, right? Inhalers are essentially steroids, right? So you take the inhaler, you flood the body with steroids. Oftentimes people get a little bit of a rush from it. And then what happens is that steroids are imitating those adrenal hormones, in this case, cortisol. And so what happens in a cortisol response, or the stress response, right, is that the bronchial passageway dilates because you're creating a fight or flight response. And in a fight or flight response, right, the blood flows to the periphery, so to the arms and to the legs, the pupils dilate, and the lungs open up, right, so that you can run away to get more oxygen. It's a survival mechanism. And so, unfortunately, those steroid inhalers, when used over the long term, have a whole bunch of side effects, mainly problems with the endocrine system, the adrenal glands, bone health, nervous system health. Like, there's a lot of problems that people can have from excessive use of steroid inhalers. But that's what we're going with a remedy like ma huang, right? Is that it's adrenergic, so imitating the adrenal response there. And so you increase that adrenergic response and all the bronchioles dilate. So I think a 50-50 pair, and this is another thing I learned from Paul Bergner, is that just giving credit where credit's due, a 50-50 pair of lobelia and ephedra, I think, should be in everyone's herbal first aid kit as an emergency asthma remedy. And you would administer that, because lobelia is in there, you would maybe start a little lower, maybe 10 drops every, I would, depending on the severity of the asthma attack, I would say 10 drops every 10 minutes maybe, just assessing, right? And if they're not getting too nauseous from it, giving more until you're gradually dilating and opening everything up. So that is a really good, simple pair to have on hand. So those are some of my thoughts there, Monica, for working with respiratory allergies and asthma. So kind of some big picture categories of plants, main actions that you want to consider, along with a couple examples of some remedies for you to look into. I, again, really want to encourage you to look into these remedies, and always, of course, making sure that those plants are suitable for the person, for the constitution. Of course, we're always looking at the tissue states. We're always looking in the energetics of the herbs and making sure there's a good match there. And of course, we're always looking at the whole person, right? We're looking at their lifestyle. We're looking at their diet. We're really doing that investigative work of finding what their core trigger points are. And I think the lifestyle dynamics are very important here for a holistic approach to treating allergies and asthma. And just overall reducing the allergic load in that person's life as much as possible, with things that they can control. Like, obviously we can't control the pollens floating through the air, but we can control the foods that we eat. We can control, what types of products we use in our house, what types of, soaps and shampoos and cleaners and things like that we use. So that would be my answer to your question there, and I hope that is helpful in your work with whoever you might be helping out with allergies and asthma.